If you have been experiencing chest pains, recently had a heart attack, or are experiencing other cardiovascular symptoms, your doctor may refer you for specialized cardiac diagnostic testing. Tidewater Heart Institute provides a variety of non-invasive cardiac testing. Our board-certified cardiologists are leading the way by offering the most advanced cardiac care available. We are conveniently located in Hampton, Virginia. Our main office is located directly across the street from our lab and has plenty of adjacent parking for your convenience. Our dedicated staff is committed to the prevention, diagnosis, and treatment of cardiovascular disease. Tidewater Heart Institute is one of the only facilities where 100% of test results are read by a board-certified cardiologist. This commitment to provide complete cardiovascular health care explains why Tidewater Heart Institute is recognized as one of the leading cardiovascular centers in Eastern Virginia. Our goal is to get patients the specialized care they need in a timely manner. For emergency diagnostics, we are able to see patients the same day. For non-emergency testing, we strive to see patients within 48 hours from initial contact. A consultation is not required prior to specialized testing. This allows you and your doctor to proceed with your plan of care as quickly as possible. Tidewater Heart Institute offers a complete range of diagnostic services, including electrocardiography, Holter monitors, nuclear testing, treadmill stress test, stress echocardiograms, event recorders, MUGA scans, transesophageal echocardiograms, and ambulatory blood pressure monitoring. These procedures are valuable tools that aid your physician in formulating the best plan of care for you. Let's take a closer look at some of the tests your doctor may request to aid him or her in the evaluation or treatment of your condition. Nuclear testing demonstrates how well blood is flowing to the heart. These tests aid in determining the presence of coronary artery disease, adequacy of blood flow through bypass grafts, and the amount of muscle damage suffered from a heart attack. A small amount of pharmaceutical is given intravenously. A gamma camera then scans your heart muscle. The radioactivity emitted from the heart is detected by the gamma camera and a picture is made. A MUGA scan is a type of nuclear testing that produces a moving image of the beating heart. Physicians use computer analysis and interpretation of the images produced. This test can pinpoint the part of the heart muscle that has sustained damage during a heart attack. Physicians can assess how badly the heart has been damaged. It also gives your doctor an accurate and reproducible way of measuring and monitoring how much blood your heart is pumping without the use of catheterization or hospitalization. This is a valuable tool that can be used over time to detect subtle changes in your heart's function. An echocardiogram, or echo, is an ultrasound of the heart. Echoes use small devices called transducers to move around your chest and take moving pictures of your heart. It gives detailed information about the heart muscle, valves, chambers, and major blood vessels around the heart. Echoes can also be used to measure pressures within the lungs and heart. These pictures are more detailed than X-rays and involve no radiation exposure. Echoes are used to identify how efficiently the heart is functioning. It can also show if fluid has collected around the heart, the presence of blood clots or masses, and the size, extent, and location of a heart attack. Sometimes it is necessary to obtain a clearer picture of the heart. Our doctors may order a transesophageal echocardiogram, or TEE. This test is used to obtain images from inside the esophagus. The esophagus lies directly behind the heart, so with this technology, very clear images of the heart can be seen. This test is performed by inserting a long, flexible probe with an ultrasound transducer at its tip through the mouth and into the esophagus behind the heart. This allows us to produce a real-time image of the beating heart and blood flow through the chambers and valves. Electrocardiograms, or EKGs, measure the heart's electrical activity by placing small electrodes on your arms, legs, and chest while you are lying down or during stress. These electrodes record your heart's electrical impulses. By observing the patterns of impulses, your doctor can tell if your heart is normal, under stress, or experiencing problems. An EKG can detect evidence of a heart attack or inadequate blood supply to the heart. Holter monitors, or EKG recorders, that are taken over a 24-hour or longer period. patients visit our office and are set up with a Holter monitor. Your physician may order a treadmill stress test to determine if your heart is getting sufficient blood flow and oxygen when it is under an increased workload. This test records your blood pressure, breathing rates, and the electrical activity of your heart while you walk on a treadmill. In situations where you cannot walk on a treadmill, we simulate the effect of the treadmill exercise on the coronary blood flow by using pharmacologic agents. Event recorders are small devices that record heart rhythm when you are experiencing symptoms related to your heart and circulatory system. The patient activates this device when symptoms occur, providing valuable information for their physicians. Event recorders are returned to our facility for further diagnostics. Our lab is state-of-the-art, with the most advanced technology, equipment, and research available in the medical field of cardiology. However, invasive procedures must still be done in a hospital setting. These procedures can include balloon angioplasties, catheterizations, and others. We have medical staff privileges at several local hospitals. Tidewater Heart Institute provides high-quality care in a comfortable and convenient environment. By offering the latest in cardiovascular technology, we provide patients and physicians with the tools to improve patient care and overall health. Tidewater Heart Institute. We take your health to heart.